Hello everyone, today I'm going to be talking to you guys about surgical approaches to heart disease. We're going to be talking about angioplasty, stents, and bypass surgery. All of these approaches are used to aid in the narrowing or blockage of an artery. And I wanted to begin with showing you guys what a regular artery looks like and what one that has been narrowed is now, what its effects are causing to the body. So as you can see, the one on the top is a regular artery. Blood flows through it with no problem, but on the bottom we have a narrowed artery. Here, the blood flow that is coming in is being restricted by this plaque buildup, or this buildup can be caused by many other things. So it's either plaque buildup, it can be caused by uncontrolled diabetes, high blood pressure, and many other things. So so blood flow has stopped, or not stopped, but slowed, and in many cases can lead to blockage of the artery itself. Blockage of the artery can lead to heart attack and stroke. So these surgical approaches are very important in the life of someone who has a narrowed coronary artery. So to begin with, an angioplasty is basically a catheter is inserted into the body either via the femoral artery or the radial artery, and it goes in through the artery and reaches the part that has been affected by the plaque buildup. And what it does is it's a catheter that has a balloon attached to the end of it. It will feed until it gets into the spot where the narrowing is and the plaque buildup is, and the balloon, so it gets here. The balloon will then blow up the balloon that's in that catheter to the size of this artery, like so. And what it does is it opens that that space that was narrowed, and it pushes it up. So then that is not there anymore, and it's pushed up. Then in many cases they will pop the balloon and put in that second procedure, being a stent. What a stent is, it's a tiny mesh wire thing, kind of, that gets put in this artery to keep this area open. And again, in many cases, many people choose this specific approach because it is not as invasive, and again, it doesn't take much time to do. So it can be taken in less serious cases. And then the last form of surgical approach that I will be covering today is a bypass surgery. The surgery is a lot more invasive, and the patient even has to go into anesthesia. So it's very invasive and very time consuming. It's an actual surgery. So the beginning of the surgery begins with the saphenous vein getting taken out of the thigh area. This vein is taken out to serve as a bypass in the heart. And what the PA and the doctor do is they pull that vein out and they ensure that it can work as a bypass, that there's no holes in it, that there's no any problems with it that will not allow it to work effectively in the heart. So they get that out and they sterilize it, they clean it through, ensure that there's no residual of anything left over. After that, they also cut the vein to the size that they need the bypass to be. This is where double bypasses come in, quad bypasses. It's just dependent on what the person needs. So they get the amount that they need, and then the doctor begins to perform the surgery on the heart. So their chest is cut through the middle, as you can tell. It cuts through their chest and through their sternum as well, and they pull that area open to the point where both the PA and the doctor can get into the heart. Yes, heart surgery is very, very imperative, and there's a bunch of people sitting in there making sure that it's all going okay, because your heart is such an important part of your body. So the doctor and the PA get into the heart. They go to the part of the heart that is or the part of the artery, sorry, that has been narrowed or has been damaged, and they start to create that bypass. So what they do is right before they get to that narrowing area, they cut that open, and they cut that open and they attach that bypass, that vein that we just took out from the thigh area, and they cut this other area right here and stitch it in. What this does is it creates a small little bypass. Oh, sorry. It creates a bypass. So the blood is skipping going through this narrowed area, so it comes in through the artery, up through the bypass, and continues to where it was headed. Again, this procedure is mostly done in people who have tried angioplasty and have tried that stent, and that are headed to more dangerous problems. So this is where the bypass is added. It's important because after this bypass, the patients are in the hospital working out, doing some exercise to get their body back up to par, and just ensure that this is actually working in their heart and that it's a safe modality for them. Other than that, it is important to note that no matter the method, the goal is the same. It is to restore blood flow and to ensure that every part of the body gains and has the blood flow that it needs, or the amount of blood that it needs. At the end of the day, it is important to remember that no matter the method, the goal is always going to be the same: to restore blood flow and to save the heart. So it is important to note that if you are in this situation, you have to speak to your cardiologist, find out which method is best for you, and understand what you will have to go through in order to get all of this done. Thank you.